My name is Carla Astafan, and I have been a potter for over 20 years. I know it's a very difficult time for all of us in the industry, but this time has given me the opportunity to really rethink the whole operation. It's given me time to do other things, to do my pottery. I'm trying to stockpile on my work. To my brothers and sisters in the tourism industry, this is a time to look towards the future. This is a time to examine what you have been doing, see what new things you can do, how you can diversify, how you can innovate, plan ahead. So with proper planning, we will all be prosperous in the future.
We are all in this together.
And we all have a part to play to keep our island COVID-free.
Play your part and stay safe and healthy.
Our borders will soon be reopened. Get ready.
So what are you doing to keep St. Kitts COVID-free? As we get ready to serve, it is important that we improve our vehicles to ensure the safety of our guests and ourselves. Outfit your vehicle with appropriate dividers to separate driver from passenger. Plexiglass or Velcro plastic divider may be used. Have a minimum of 2 hand sanitizers, one for you and one for your guests. Always carry extra mask and disinfectant in your vehicle. And post signs to remind passengers to use hand sanitizers and wear their mask and follow social distancing protocols.
When providing a service, it is important that the hands of the passengers are sanitized before entering the vehicle. Remember, a mask must always be worn by all occupants of the vehicle for the duration of the trip. At the end of the trip, remember to wish your passengers a good day. Ensure they have left no personal items behind and sanitize their hands.
Once you have completed your trip, remember to sanitize your hands and your vehicle. Seats must be disinfected and all high-touch areas, such as doors and seat handles, must be sanitized before your next trip. Let's do all we can to keep ourselves and our visitors safe.
Good evening, everyone, and welcome to Leadership Matters. Joining Prime Minister Dr. the Honorable Timothy Harris tonight is the Chief Medical Officer, Dr. Hazel Laws, who last month was named a recipient of the Companion of Star of Merit, which is an award that falls under the National Honors Act. The Chief Medical Officer was named for this award based on her national service in a crisis. Tonight, a topic of discussion will be COVID-19 health protocols that have been put in place ahead of the full reopening of the Federation of St. Kitts and Nevis's border crossings, which is scheduled for October 31st. A lot will be discussed tonight, but first I invite Prime Minister Harris to present his opening remarks.
Thank you very much, Valencia. My fellow citizens and residents, greetings. I appreciate that each week, across several media platforms of ZIZ Radio and TV, YouTube and Facebook, thousands of citizens, residents and well-wishers tune in to this very informative program. It is one way in which we demonstrate accountability as a government by and for the people. I am happy to provide leadership that matters, leadership that cares, for the people of St. Kitts and Nevis. Tonight we focus on the big story. Our country's borders will be fully opened up to nationals and visitors from the 31st of October 2020. In my press conference last Thursday, I said, among other things, St. Kitts and Nevis has come a long way in its successful management of the COVID-19 cases. We are designated by the United States-based Centers for Disease Control as a very low-risk destination. We are one of the 8 countries approved for the CARICOM bubble, presently includes Anguilla case. We have insisted that our citizens and residents comply with all health protocols, especially the wearing of masks in public, frequent hand washing, physical and social distancing, and we encourage our citizens and residents to avoid large crowds and areas of heavy congestion. These practices have to become second nature to us as we work to protect ourselves, our families, our friends, and loved ones. Given that all our cases of COVID-19 to date are travel-related or imported cases, strict compliance with the health protocols is the only way to contain the spread of the virus, thereby minimizing any strain on our small health system and loss of employment and productivity due to quarantine, isolation, or hospitalization. It is my fervent hope that our citizens and residents will prepare themselves for a significant increase in the numbers of returning national and visitors between November and December. I say significant because with our borders now closed, the arrival and departure numbers are very small. These numbers will definitely climb as the number of flights in and out increases. It is probable that new infections of COVID-19 will come with the opening of our borders. Our protocols, which we are insisting upon, are intended to minimize that risk and to keep us all safe. I ask for compliance of the protocols by all in society. The lessons from Barbados, Antigua and Barbuda, Trinidad and Tobago, and indeed everywhere, particularly in Europe, is that we should never become complacent in our efforts to contain the COVID-19 disease. The best way to do so is to comply with the health protocols. Trinidad and Tobago has determined that in light of COVID-19, its world-famous carnival will no longer be held in February 2021. Here at home in St. Kitts and Nevis, we have reduced our usual list of events to minimize any spike from hosting of carnival. Between now and October 31st, the government expects that close to 5,000 persons who are part of the provision of services to returning passengers, be they at the airport, taxi operators, hotels, restaurants, tour operations, will be trained to work safely in a COVID-19 environment. The National Task Force on COVID-19 and the Ministry of Tourism, including the Tourism Authority, will have determined those entities that can be certified as being compliant with COVID-19 protocols and hence can be certified as part of a bubble of low-risk services and entities that visitors and residents can access. Ongoing work, of course, on getting our entities up to speed will be diligently pursued by the task force and the entities themselves. Since our announcement of the 31st October opening date, our Chief Medical Officer, Dr. Hazel Laws, has been meeting with hoteliers, and so far the meetings have been productive and constructive. I am advised that discussions have taken place with Park Hyatt, Marriott, Four Seasons, Koi at Hilton. Our task force is open for continuing discussions as and when necessary. Hotel operators are finalizing the list of on-compound services which they can safely provide to their guests, and discussions are ongoing regarding access to selective excursions or tourist sites which visiting guests can safely access. Examples may include Brimstone Hill, Zipline, ATV Tours, Safari Tours, Romney Manor, Rainforest Tours, and selective beaches. The list, of course, is not exhaustive. There are two broad categorizations to determine the extent and timing of integration by tourists into our society. This is, of course, based on their country of origin. These destinations can be broadly categorized as those which are part of a bubble, that is, low-risk countries and other countries which we may classify as high risk. Key protocols obtained in each case, and our Chief Medical Officer may address these tonight. In this regard, I want to welcome Dr. Hazel Laws to Leadership Matters tonight. I want to join Valencia in congratulating Dr. Laws and being a recipient of the Companion of the Star of Merit for outstanding leadership of the health sector at this time of COVID-19. Equally, her colleague, Dr. Cameron Wilkinson, has given yeoman's service for which he too has been awarded. And Mr. Abdia Samuel was equally recognized for his outstanding leadership at the head of the National Task Force. Dr. Laws, I welcome you to Leadership Matters tonight.
Minister, I now turn to Dr. Hazel Laws, our Chief Medical Officer, to present her opening remarks.
A pleasant good evening to everyone who has joined us this evening. Thank you, Honorable Prime Minister, and thank you, Valencia. The COVID-19 SARS-CoV-2 virus has proved a formidable adversary. Between January and present, the virus has left over 35 million confirmed cases in its trail, along with over 1 million deaths globally. In the Caribbean region, over 232,000 confirmed cases have been reported, 136,674 recoveries, and almost 4,000 deaths. And this is as of October the 5th. In the CARICOM member states, 42,217 confirmed cases, 28,855. It reaches those at the top. President Donald Trump affected with COVID-19. The list of world leaders who tested positive for COVID-19 thus far includes President Jair Bolsonaro of Brazil and the Prime Minister Boris Johnson of the United Kingdom. In St. Kitts and Nevis, we have reported 19 confirmed cases of COVID-19 so far. 17 have recovered, and there are 2 active cases, and the patients are stable as we speak. Tourism is the main economic driver for the Federation. 6 months ago, our borders were closed to international travel to help contain the first wave of COVID-19 infections. This has adversely impacted our economy. We must now strike a balance between the public health measures employed to fight this disease and the facilitation of economic activity. Last week, the Honorable Prime Minister announced that our borders will be opened on October 31st to international travelers. The aim is to reopen safely with minimum risk of reintroduction of the virus to the Federation. Appropriate protocols are being developed and confirmed to ensure safety of our people and safety of the inbound traveler or tourist. By way of background, we have looked at other Caribbean member states that have opened their borders ahead of us and have noted the best practices. Most Caribbean member states require inbound travelers from hotspots to submit a negative COVID-19 PCR pre-arrival test, and they must complete some form of quarantine upon arrival. The Caribbean member states are utilizing different models of quarantine. For example, in St. Lucia, effective September the 25th, persons from outside the Caribbean bubble must complete 14 days of quarantine at a COVID-19 approved quarantine site. St. Lucia officially opened its borders on July the 9th, and in that first phase, they only started with 2 COVID-19 approved all-inclusive hotels. The list of accommodations or hotels was expanded in the subsequent phase. Tonight, my task is to provide you an overview of the protocols for reopening our borders in the context of this pandemic. We are taking a phased approach. And so in phase 1, all inbound travelers to the Federation will have to log on to the national website prior to traveling to complete and submit the entry form with required details, including evidence of a negative COVID-19 PCR test done within 3 days of travel. This PCR test must be done at an accredited laboratory. All inbound travelers to the Federation will fall into 2 categories. The first category will involve those travelers coming from a territory within the Caribbean bubble with minimal risk of exposure to the virus. The second category will involve travelers coming from a territory outside the Caribbean bubble with significant risk of exposure to the virus. So now at this time, I'm going to explain what happens with the first category. So inbound travelers from within the Caribbean bubble refers to a traveler from any of the 8 Caribbean member states, including Anguilla, Antigua and Barbuda, Barbados, Dominica, Grenada, Montserrat, St. Lucia, St. Vincent and the Grenadines. These islands met the inclusion criteria, having reported less than 20 new COVID-19 cases per 100,000 population within the past 14-day period. Please note that the Ministry of Health will be monitoring the situation in these territories continuously, and member states will be removed from this list if community transmission of the virus is reported. Once you travel directly to the Federation from a Caribbean bubble territory where you resided for at least 21 days, you have submitted a negative PCR test, you will be subjected to regular screening upon our arrival at our airports, and you will be asked to upload the national COVID-19 mobile application whereby you will be monitored for the first 14 days. When we say that you will be screened at the airport, you will be asked a number of health-related questions and your temperature will be taken. Once without symptoms or once asymptomatic, you will be allowed to integrate into the Federation without a period of confinement or quarantine. Inbound travelers from the Caribbean bubble can stay at private homes and at the COVID-19 certified non-franchise hotels. Please note that all arriving passengers from within the bubble who have been in transit in a country outside the bubble will be included in the second category. Now I will provide you an overview as to what happens with the second category. Now this category involves inbound travelers or tourists and returning nationals from outside the Caribbean bubble. There will be several COVID-19 approved accommodation options, including government designated facilities, the Ocean Terrace Inn, Royal St. Kitts Hotel, Oali Beach Hotel, and Potworks in Nevis. It also involves the pre-approved or certified quarantine or confinement sites with appropriate security facility, and the franchise hotels. The inbound traveler in this category will be required to submit a negative PCR test result done within 3 days of travel at an accredited laboratory. The traveler will be subjected to screening at the airport and will be requested to upload the National COVID-19 mobile app. Once without symptoms or asymptomatic, the inbound traveler will be allowed entry into the Federation. The inbound international traveler or tourist will then be vacationing in place at the certified hotel with access to an approved package of services for the first 14 days or for the duration of stay if shorter. The international traveler or tourist will be required to do serial testing. The tourists will be tested on day 7 and on day 14 if still in the Federation. Tourists who receive a negative PCR test on day 7 can be allowed to access selective excursions or tourist destination sites on the island in a secure bubble. All inbound travelers must receive a PCR test on day 14 of their vacation, and once the result is negative, the traveler will be allowed to integrate into our society. If the trip or vacation is less than 14 days, the tourist can easily depart the Federation with an exit test. Tourists in this category can only use COVID-19 certified taxis or ground transportation with appropriate petitions to move between the airport and the designated hotels and to move between the hotels and the COVID-19 certified excursion or tourist sites on the islands. As I said before, we are going to take a phased approach. And so the second phase will involve an expanded list of hotels certified to accept inbound travelers or tourists with significant risk from hotspots. Such hotels must submit the appropriate protocols to ensure safe operations and minimal risk of COVID-19 outbreak on property. This through the following measures. 1. All stakeholders should adhere to the infection prevention and control measures to ensure safety of our frontline workers, safety of our people, and safety of all inbound travelers and tourists. 2, we must all wear face masks when in public spaces. We must always maintain good hand hygiene. We need to wash our hands regularly. We need to use appropriate hand sanitizers. We need to get back to this practice. These practices should now become second nature. Number 4, we need to maintain adequate sanitation in the school setting, in the workplace setting, in the business places, and particularly in the high-risk settings, like in our prisons, nursing homes for older adults. Number 5, we need to maintain physical distance of more than 1 meter or 3.3 feet when out in the public. We need to avoid crowds and events with significant number of persons gathered together. They are now deemed super spreader events. So each of us have a responsibility to avoid crowds. Ladies and gentlemen, as we approach October the 31st, we must get back into the habit of protecting ourselves from the virus. We are recommending that each one reach one to encourage these safety practices. Thank you.
Thank you very much, Dr. Hazel Laws, for quite an informative presentation. We have heard quite a lot, and I'm sure our audience members have plenty of feedback and questions. The call-in numbers are 869-466-2666, 662-8674, 767-4765, and our overseas line is 239-645-4500. Questions can also be sent via WhatsApp to 869-661-5683. However, first preference will be given to those who phone into the program. We'll be back after a break. You will see some messages from the St. Kitts Tourism Authority's St. Kitts Ready campaign and the Chamber of Industry and Commerce. When we come back, we'll take your calls.
My name is Carla Astafan, and I have been a potter for over 20 years. I know it's a very difficult time for all of us in the industry, but this time has given me the opportunity to really rethink the whole operation. It's given me time to do other things, to do my pottery. I'm trying to stockpile on my work. To my brothers and sisters in the tourism industry, this is a time to look towards the future. This is a time to examine what you have been doing, see what new things you can do, how you can diversify, how you can innovate, plan ahead. So with proper planning, we will all be prosperous in the future.
We are all in this together.
And we all have a part to play to keep our island COVID-free.
Play your part and stay safe and healthy.
Our borders will soon be reopened. Get ready.
So what are you doing to keep St. Kitts COVID-free? As we get ready to serve, it is important that we improve our vehicles to ensure the safety of our guests and ourselves. Outfit your vehicle with appropriate dividers to separate driver from passenger. Plexiglass or Velcro plastic divider may be used. Have a minimum of 2 hand sanitizers, one for you and one for your guests. Always carry extra mask and disinfectant in your vehicle. And post signs to remind passengers to use hand sanitizers and wear their mask and follow social distancing protocols.
When providing a service, it is important that the hands of the passengers are sanitized before entering the vehicle. Remember, a mask must always be worn by all occupants of the vehicle for the duration of the trip. At the end of the trip, remember to wish your passengers a good day. Ensure they have left no personal items behind and sanitize their hands.
Once you have completed your trip, remember to sanitize your hands and your vehicle. Seats must be disinfected and all high-touch areas, such as doors and seat handles, must be sanitized before your next trip. Let's do all we can to keep ourselves and our visitors safe.
The St. Kitts and Nevis Chamber of Industry and Commerce would like to remind persons when patronizing businesses to abide by the following COVID-19 guidelines to protect employees, customers, and our community. Urge employers to check employees and customers with a non-contact head thermometer on arrival to a business place. It's mandatory that employees wear a face mask when at work and in the presence of others. No customers will be permitted to enter an establishment without a face mask. Encourage both employees and customers to wash their hands with soap and water or sanitize their hands with an alcohol-based hand sanitizer of at least 60% alcohol when entering a building, after interacting with customers, and throughout the day. Remember to maintain 6 feet physical and social distancing. Consider installing barriers such as sneeze guards or partitions in high traffic areas to limit close contact between employees and customers. Clean and disinfect highly touched surfaces such as doorknobs, telephones, cash registers, bathrooms, tables and countertops regularly throughout the day. Offer e-commerce services or curbside pickup options wherever possible. Encourage good hygiene practices among staff and customers by posting signs and posters in the business place. For more information and tips to consider, visit www.covid19.gov.kn.
Welcome back to Leadership Matters. We have a couple of callers on hold, so we'll go straight.
Come with the same thing. And the border is going to open. And I hear a lady was asking you that the doctors and nurses going back to Cuba. And you were saying how much it cost the Federation? 800,000. And 1 million something there. So going to let me know after I don't speak. And when Mrs. Law started to speak, Mrs. Law said she would like to have them for next 6 months. But if you have them for next 6 months, let the people them around the doctors and nurses around a thing or two. Because when they're gone back, you know, that we should get something from them. Well, all I have to say that the gate is going to open. And I hear General Powell were talking about the carnival, like he put in it off. But a lady come on the radio, she must be the trio woman of carnival. And she talking something different. I think the two of them should be talking the same thing. So I don't know what's going on now. Because people are listening. And I think you're the leader of this country. You're going to take over because both of them talking different. One says something off and one come make it say calypso sugar and go on. And do it for hear right. So you know sometimes you don't hear right. So I want you to ask this question for me because I mean I was in Carnival last year. And I had a booth 4,005 and may make nothing. And I don't see how people are going to make something all like I know. Because I know dance going to can't pay for the lights. And I think that petition and division, right, come forth in anything. I sure about that. Because I know you is a good leader. But when they're going to be picking out work, and we understand sometimes you short and notice and so in a certain areas. I think some young people, young man and young woman should get into this professional business, you know, because we're going to need them. Because health mean a lot. If you can't eat and sleep and drink and work, you know, health. And health costs a lot of money. So here what figure you call in. So if they here for next 6 months, you know, what kind of money we're going to get to end up paying. So I want you to get the people them, young people them. This ain't no jam and wine business. This is not no future for the people. So you talk.
Thank you, caller. We hear you loud and clear. Thank you. Good night, caller. You're live on Leadership Matters.
Good evening. Thanks for taking my call. Good evening, Mr. PM.
Good evening, sir.
Dr. Laws. And thanks for spending another Tuesday night with us, Mr. PM. Very briefly, what may have been some of the factors which convinced your administration that the border should be opened on October 31st? That's one. In a previous press conference, you mentioned about some work going on at the airport in the Robert Llewellyn Bratcher Airport to accommodate the testing of persons coming off aircraft and that sort of thing. Would the same exercise be done in Nevis to test persons coming in on those small aircraft, and especially people like Winnie, knowing that St. Martin is a hotbed for the COVID virus at the moment, and they do dump a lot of people into Nevis? And thirdly, there was some mention of the taxis and other welcoming bodies who are expected to undergo training before the 31st of October. Will the same thing be done for persons in Nevis? Because I do not like to see that we are well guarded in St. Kitts and the gates are open in Nevis. I'll listen off air for your answers. Thank you, and thanks very much for spending another Tuesday night with us.
Thank you, caller. We have 2 callers on hold. Good night. You're live on Leadership Matters.
Hello.
Hello, we can hear you. Just speak into the phone, please. Thank you.
Yes, good night. Good night, Mr. Prime Minister, this Granny, Dr. Lord. Quick 2 questions. Caller just stated, like, you know, St. Martin is a hotspot. For instance, on the question, I was listening, Dr. Lord, and she stated, like, people coming from certain countries. Okay, for instance, I don't think Anguilla have any corona, right? This question is, if you have people coming from Anguilla, and you know, Anguilla is a straight flight, even though if they do a test, do they have to quarantine? And another thing that you stated, I mean, I understand, but it mightn't have people out there who really understand what you were trying to say. When you have tourists into the country, upon 7 days, you stated that they could go to certain spots like zip lining. I think it's like I was trying to say, Brinston Hill, more or less like open places. If you could really put some emphasis on that and really to preach to the general public, yes, tourists have, you know, within 7 days of quarantine, after 7 days. Like, if it's that you was trying to say that they could, you know, go out, and if they're still in the country upon 14 days, right, they could take the test and whatever the case may be. But to acknowledge from the tourism sector, yes, we had a meeting today, and P.S. Carleen Morton, Mrs. Carleen Morton, she stated that, yes, there are taxi men who are now, you know, doing training upon such things, and I want to acknowledge to all the bus drivers them out there, yeah, I might think that is a joke, but it's not a joke. You could listen to Traffic Talk tomorrow, and I'm going to explain more. Please, when the 31st reach, make sure at least y'all have y'all hand sanitizers, y'all have y'all masks, and Prime Minister, I know you stated on when the bus terminal is opening, that if stated to the commissioner of police that if the people them don't want to wear the mask, jack up the price. The ticket them ain't ready yet. Too much people, dropping back. Thanks. Yeah, listening to the program.
Thank you very much, caller. Good night. Caller, you're live on Leadership Matters.
Good night, Leadership Matters.
Good night.
Good night. I want to say good night to the Prime Minister, Dr. Honorable Timothy Harris, and good night to Ms. Laws. Ms. Laws, congratulations on your latest achievement, and there's more to come once you continue on the right path with the Prime Minister, Leadership Matters. Now, before let me go, Mr. Prime Minister, I want to thank you for continuing to keeping the country safe. I must emphasize on that because people are now looking at small little things who was now at that. It's now a big circle for leadership. So thanks and continue. We are behind you. Now, Dr. Laws, is there any challenges where there are hotels that will have just persons who are quarantined versus guests? The reason why I'm asking this question, I don't want a case where you have persons supposed to be quarantined in a hotel and other guests, and then by some reason they interact. So I want to know. I heard you mention some hotel and different things, but I was trying to follow. So maybe you can give a little more insight on it to say, well, okay, yes, there are some challenges with hotels who don't want to use their establishment as quarantine destination, or yes, they are cooperating, or yes, we might have challenges where some will have, like for example, the market is very big. You can have a section and you can part it off, say, hey, this is for quarantine, and this.
And then we will go to
Dr. Harris. I want to give you all the high praises for the way you and your government have been running this country, that bring us to this safe journey of destination, that everybody in the outer world can look at us as an example of controlling this virus. And that praise goes to Dr. Laws and your full task force team. Now I have two questions. Dr. Laws, now is there any vaccine in the world to kill this virus? That's one. And if so, how come so many people in the world have gone on to the great beyond because of this virus epidemic? And we already passed the 1 million mark of this epidemic affection to people. And one person got sick, and in 3 days' time, they're out of the hospital, and said that the doctors them say that they give him a good bill of health. Now, can anybody get rid of this coronavirus in 3 days? That's a serious question that have me all tangled and puzzled, because I don't understand if that is so. Well, how come the WHO not publishing it and giving it out to the whole world and have people every day dying and sick? So those are my little questions. Continue doing the good work. You all are going great. Thank you very much for listening.
Thank you very much. Good night, caller. You're live on Leadership Matters.
Hello.
Go ahead, please.
Hi. Yes, I am just calling in to give my congratulations to all on the program this evening. I want to greet first the Valencia Grant and my fellow Keanoites, and greetings to Dr. Laws and to the Honorable Prime Minister, Dr. Harris. Dr. Laws, as a fellow Kititian and as a physician, I want to offer you my congratulations, my greatest congratulations to you. You have done what people with vastly more resources have not managed to do. And in so doing, you have put them all to shame. I congratulate you. I carry my pride everywhere, and I tell everyone about the experience in St. Kitts, because we have done well, and we should be proud of it. And I'm glad to see that you were honored during the Independence Honors. Well deserved, well done. Thank you. Good evening.
Thank you very much, Dr. Gavin Hamilton. We will turn to the panelists to have them answer the questions that were raised. I'd like to bring in a question that I received via WhatsApp. It says, "Good night. I have been asked this question over and over, and only the PM could answer. Could you please tell us, would we be having a VAT day or 2 days?" Thank you very much. So we will turn to our CMO, Dr. Hazel Laws, to address some of the matters that were raised.
Okay, thank you, Valencia. I think the first caller, he spoke about the team of health personnel who would have come to St. Kitts from Cuba. As we mentioned last week, I think plans are in place for them to remain on island for an additional number of months. I just wanted to share with the public that these health personnel, they are working. They are working at our hospitals, and they also provide care at our health centers. The second caller, he asked about what factors would have gone into the consideration of or the decision of opening on the 31st of October. And so yes, there are infrastructural changes taking place as we speak at the RLB International Airport. And so the timeline for this work was a key factor in determining the opening date. Now, the infrastructural changes at RLB involves recommissioning of the lounge into a health station, and there will be 4 counters whereby the incoming traveler will be screened, whereby the health personnel or the port health officers will ask the tourists pertinent questions regarding health. And then it's also in this space where the temperature of the incoming traveler will be taken. And so it's our intention that these changes be mirrored in Nevis at the Vance Amory Airport. So we are hoping to have 4 counters at RLB and 2 counters at Vance Amory in Nevis. The training of our frontline workers, meaning training of our custom and border workers, training of all the workers in the hotel and tourism sector is also another critical factor. And I must assure you that this training is across the board, St. Kitts and Nevis. And this training began a few months ago between the Ministry of Tourism, the Tourism Authority, and the Ministry of Health. And just this week, the Pan American Health Organization is collaborating with us in terms of facilitating 3 important training sessions. We had one on Monday, whereby custom and border workers were exposed to a training session. And then tomorrow, Wednesday, and Thursday morning, persons working, the frontline workers in the hotel and tourism sector will be beneficiaries of a training session facilitated by an advisor from the Pan American Health Organization. And these training sessions will be repeated next week. And these training sessions are attended by workers in St. Kitts and in Nevis. Another important factor was the development of the appropriate protocols. And this is the development of these protocols is a work in progress. The other caller, he spoke about, or he asked about Anguilla. And yes, Anguilla is considered part of the Caribbean bubble. And so if you are coming from Anguilla to St. Kitts, we will ask you to provide us a pre-arrival PCR test. And so once that is negative, and once you would have been in Anguilla for at least the previous 21 days, you can come to St. Kitts. You will be screened at the airport, and once you are without symptoms, you can be allowed to integrate into the society without quarantine. The other caller went on to ask about what happens at the franchise vacationing in place at our franchise hotels. All right, so they would have given us a negative test before coming. They would have been screened at the airport. Once they are without symptoms, they will then move from airport to the franchise hotel. Now, between day 1 and day 7, if the guests would be able to use a restaurant, use the beach, etc. Now, on day 7, if the duration of the vacation is that long, that tourist will be tested, and then if negative, the tourist can have access to additional services on island. They can go to the tour desk at the hotel and by appointment organize a tour to one of the tourist sites or an excursion, from a predetermined package of excursions and tours. And then on day 14, if the duration of the visit is that long, the tourist can be tested on day 14, and if negative, the individual is free to integrate into society, and they can can access a meal at a regular restaurant. They can even move from a franchise hotel to a non-franchise hotel, a non-branded hotel. The other caller asked about the differences in the hotel. All right, so if you are, and remember, an incoming traveler can be found in 2 categories. You're either coming from the Caribbean bubble, and if you are without symptoms, you can stay at one of the non-franchise hotels or at a private facility or private home. If you are coming from a territory outside of the bubble or a hotspot, right, you can stay at a franchise hotel. So that's the difference. The other caller asked about a vaccine. Is there any vaccine to kill the virus? Now, vaccines do not really kill the virus. The vaccine is given to you to prevent you becoming ill if you were to pick up the virus. And to date, there are a number of vaccine candidates on the market. However, the research work regarding these vaccines are not yet complete. So at present, there isn't an established vaccine identified to prevent one from picking up or getting ill from COVID-19 virus. There was another question regarding care will be continued at home. I don't quite remember that question. The other caller, I want to thank you for your kind words of congratulations. Thank you.
Thank you very much, Chief Medical Officer. I will turn to the Honorable Prime Minister to give his input. Honorable Prime Minister.
Thank you very much, Val. I want to thank John Paul for calling in. And just to repeat that we brought in about 34 medical officials as part of a medical brigade coming from Cuba to assist. It was really a precautionary move to strengthen our capacity of the health system to be able to deliver, particularly if COVID-19 was to become significant in St. Kitts and Nevis. The cost of accommodating, I should say of having the Cubans here to date is about $1.3 million. That cost includes the cost of having them accommodated at a hotel, their monthly stipend, and of course the cost of the charter services which would have brought them into St. Kitts and Nevis. So it is a significant cost, And like John Paul, I believe the rest of the country is hoping that there is a sharing of knowledge, and therefore in those areas where we may have some lack, that we are basically enhancing our ability to be able to provide these services. The majority of them are specialists, and it therefore means when things get back near normal, we will have to ensure that we target the kinds of training that we would want to make available to persons, and how we are going to incentivize that through scholarships or other mechanisms. In other words, we'll have to say we do not need general providers of services in particular area of nursing, in medicine. We want these specialists, and only these services we will entertain in terms of scholarships. So that is a matter that we will have to revisit. The issue is with respect to Carnival. I think what has been clear is that the normal lineup of activities or events, better put, that we will have for Carnival, for example, Juve Jam and Children's Parade and those kind of activity are not on for this Carnival season, and that the other items are going to be scaled down. So if there is a Carnival show, that of course can be delivered virtually, and virtually mean there'll be no congestion, there'll be no large crowd. Essentially you will follow it, just as you're following the program tonight. So that should keep us all relatively safe, John Paul, and there will be no need for concern. The jam and wine business, as you've phrased it, will certainly not be part of what we would want for Carnival. And it's not just here that countries have taken stock of what Carnival activities do in terms of the abandon with which people move, the loss of control, etc. And they have put either an end to them in the case of Trinidad and Tobago, or done some dramatic reorganization of what their carnival would look like. So we are not alone in reorganizing, in showing deference, if you will, that we are in a COVID environment, and the gathering of mass crowds, and in an arena in which people tend to, as it were, behave in a particular way, boisterous and otherwise, that those particular situations are not to be encouraged. Jean Howell raised the issues with respect to what would have driven us to open the borders. I would just like to endorse the response given by Dr. Laws. We had also taken into account the readiness and awareness within the country, because that is also, or those two are critical elements. Are our people aware that we are in a new order in terms of living? Are our people aware that some of the things we used to do yesterday or before March 28, when borders were locked down, we cannot now do in an environment of COVID? And we believe that the majority of persons are. We are urging and encourage everyone with respect to, and another reason why we determined it was about time to open the border. The borders, again, we are opening not just for tourists. I believe that the initial loads which we'll get would largely be borders were closed. It became inconvenient to them, and they are longing to come back home. So part of the reason really is to bring that comfort, to reunite families, to get people back home, to attend to their jobs, etc. Those are some of the reasons that propel us to determine that the time had come. But in doing that, of course, health and safety were always of critical concern to us. And that is why we ensured, for example, or we are ensuring that our main port of arrival, Robert Llewellyn Bratcher International Airport, is being reorganized, retrofitted, made fit for purpose to ensure minimum challenges would arise. And then, of course, the economy needed that additional boost. We had significant numbers of persons who had been displaced or on lower income as a result of the closure of the hotel properties in St. Kitts and Nevis. That has created a significant burden. No one had predicted when the virus became first known that it would be with us as long as it has been. And the projections are that we will have or will be operating in a COVID-19 environment perhaps next year and perhaps even up to 2022. So that is why we have to do the adaptation. Now, in terms of the stimulus package so far from Social Security, $24 million of support. $24 million of support have already been committed. And in terms of the additional persons that we have brought on to PAP, the PAP program is now running at about $16.1 million. So we are talking just among two programs, the stimulus package and the PAP program. We are now up to $40 million being expended to support families on the island of St. Kitts and on the island of Nevis. Island of St. Kitts and the island of Nevis. So it is a significant sum, and of course we would want to have more people at work, safely at work, so that these kind of gratuitous payments do not become unsustainable. And that again is another motivation why we have determined it is time to move where we are at. We also had the benefit of experience, seeing what had worked in other countries and being put at a better position to improve upon them or to improve upon their implementation. So, Mr. Howell, those are the reasons. There was not a single reason, but a number of reasons why we determined on the 31st of October. The perhaps most critical one in terms of the date was the fact that the work that is now being undertaken at the airport, according to the chairman of SCASPA, Mr. Hobson, would be completed on or about the 26th of October. That then made us fine-tune the 31st of December, give and take in case there are any difficulty in any area. We are hoping, again, based on the best advice put by Ballet Management Company, that we will be ready on that date. With regards to the issue of VAT Day, this is a matter really which had not been given active attention at this particular moment in time, but it has come now, and I think last week it had come in some form. I will formally allow for a discussion of this next Monday, and therefore perhaps by next Tuesday one can say. But I want to advise that we are in a difficult time where cash flows are limited, and therefore the kind of benefits that we would have offered in a season of high inflows would not normally and could not be prudently be made available. But we will look at it in fairness to the public, in fairness to the fact that persons had become accustomed. We will give it some consideration and then make a determination. I want to thank the other caller who had called, no doubt from abroad, for the commendation as to the work that we are doing here in St. Kitts and Nevis. And we really think that our successes and the management of COVID-19 indicates that St. Kitts and Nevis is a leader in the world, where some of the most powerful countries are still having difficulty we had used a stepwise approach to the opening up of our economy and society to the point now we have done so as successfully as any other in the world. And all of us can take pride, can take encouragement by the fact that the decisions which the government has made so far have been the right one and has kept the majority of persons in St. Kitts and Nevis safe and secure.
Thank you very much, Honorable Prime Minister. We have about 3 or so travel-related and border-related questions that came in via WhatsApp or online. I see that someone has said that a matter is yet to be addressed. I have taken note and will follow up with you this week. Someone WhatsApped me, and I'd like to read it. Good night to the entire panel. Hi, Ms. Grant. Thanks for your assistance in getting the information that I inquired about. You are definitely on the job. I can attest to that. Thank you, Mr. Marishaw. His question is for the Prime Minister and Dr. Laws. What's the status on quarantine procedures for returning nationals who have their own private property? What's the status on quarantine procedures for returning nationals who have their own private property? Then I'll go to a question here. Good evening. I'm a tourist traveling from the U.S. and have a villa booked in Nevis next month. My family and I will be there for a week. Do we have to cancel our villa and stay in an approved property in Nevis? Can you provide the name of the approved places in Nevis again? Are we able to travel on the regular passenger ferry to get to Nevis? Can you provide more info for those going to Nevis? Thanks. Then we have another question here. We need to go back to the drawing board. Oh, well, I see the phone line flashing. I'll continue reading after we take this call. Good night, caller. You're live on Leadership Matters.
Hi, good night.
Good night.
Good night to the panel, especially the PM. I'm calling concerning returning nationals. I was understand that is for $600 for the current food and lounge is not included, and also $100 for testing. And if you want to stay in your home, you have to pay $20 per hour for someone to stay with to watch you, and for 24 hours, and see if you can come up with something that can help the nationals coming home. Because a lot of people like to come home, don't mind quarantine, but the price is too high, it's too steep. Because you must understand, you say food and food and lounge is not included. So when you have to pay that kind of money, how are you going to get eat? So I would like you all to go back to the drawing board and work out something for us. Thank you.
Thank you, caller. Good night, caller. You're live on Leadership Matters.
Yes, good night. Yes, good night to the panelists, Mrs. Lords, and the Prime Minister, the Honorable Timothy Harris. And I'm saying to you all that you all are doing a great job and continue to do the good job that you are doing. I really call in tonight, Mr. Prime Minister, on a matter I had with you calling in about a long-term loan I had with Development Bank. And I called the person you told me to call. I haven't get any answers yet. But I would like to, Mr. Prime Minister, to sit down with you and talk one-on-one with you. Because this thing is really want to send me off, Mr. Prime Minister. Please give me a setup to talk with you one-on-one, please. And I'm praying that you will continue to do a good job.
Thank you. Take note of the number of the press secretary, 762-1558, and she will make the arrangements. 762-1558.
Thank you very much, caller. Thank you. Good night, caller. We're live. You're live on Leadership Matters. What's your question?
Good night. Good night.
Good night. Go ahead, please. Yes, we can hear you. Just speak into the phone.
Good night. I would like to ask the Prime Minister a question. PM, I would like to know that the travel, like between the Caribbean, do they have any airline sustainable at this moment that they can travel in the Caribbean? Let's say you want to go to Barbados, St. Vincent, Grenada, and etc. other countries. So can you please enlighten me and tell me what's the status that when you're going to different Caribbean countries? I would like to know that, please. You understand, for people like who going to maybe Trinidad, maybe they for the health. I mean, for to deal with the health, like if they're going to do any surgery in Trinidad and maybe different countries, you know. So I would like to enlighten me in that. And next question I want to ask Mr. PM, I would like to ask you that, like basically, how like to go towards to see you, like if somebody want to see you, like how the procedure go? Because people, they still want to get to see you out in the public, want to come to your office and see you directly. Because some people want to talk on the phone and etc. They want to come and put the issue so you can rectify them and assist them in any way. Thank you.
Thank you.
Thank you, caller. Yes, I think I was in the middle of reading the question from the caller who actually called immediately after. She said consideration ought to be given to a tier system where nationals pay substantially less than visitors for quarantine. And then the last question here before we go to a break and then come back. I would like to know, as a Canadian coming to visit St. Kitts for a month post the quarantine process, what are the procedures? The layover is through the United States. Can I quarantine with my fiance, or do I have to stay in the 8 approved hotels? If so, what are the fees? And do I stay till a negative test, or for the entire 14 days? Fiance lives in St. Kitts as a student and has not traveled. The PCR tests upon 7 days and 14 days mentioned by Dr. Laws. How much are they, and who covers the costs? Thanks in advance. Okay, when we come back, we'll answer questions and we'll take some more calls. I'll remind you of the numbers: 869-466-2666, 662-8674, 767-4765, and our overseas line is 239-645-4500. We'll come back after the break.
The St. Kitts and Nevis Chamber of Industry and Commerce would like to remind persons when patronizing businesses to abide by the following COVID-19 guidelines to protect employees, customers, and our community. Urge employers to check employees and customers with a non-contact head thermometer on arrival to a business place. It's mandatory that employees wear a face mask when at work and in the presence of others. No customers will be permitted to enter an establishment without a face mask. Encourage both employees and customers to wash their hands with soap and water, or sanitize their hands with an alcohol-based hand sanitizer of at least 60% alcohol when entering a building, after interacting with customers, and throughout the day. Remember to maintain 6 feet physical and social distancing. Consider installing barriers such as sneeze guards or partitions in high traffic areas to limit close contact between employees and customers. Clean and disinfect highly touched surfaces such as doorknobs, telephones, cash registers, bathrooms, tables, and countertops regularly throughout the day. Offer e-commerce services or curbside pickup options wherever possible. Encourage good hygiene practices among staff and customers by posting signs and posters in the business place. For more information and tips to consider, visit www.covid19.gov.kn.
We are all in this together.
And we all have a part to play to keep our island COVID-free.
Play your part and stay safe and healthy.
Our borders will soon be reopened. Get ready.
So what are you doing to keep St. Kitts COVID-free?
Welcome back to Leadership Matters. I'll go straight to Dr. Hazel Laws, our Chief Medical Officer, to weigh in on some issues that were raised.
Okay, thank you, Valencia. A number of the questions refer to you can access accommodation at the government designated facilities. The OTI is still available, and the cost is $100. You have other options in St. Kitts, the Royal St. Kitts Hotel. You can call the front desk and you can negotiate the room you like and the cost. In Nevis, you have the Oahu Beach Hotel and you have Potworks. But if you are a returning national and you have a villa, or if you have a home in the Federation, you can apply. We have a facility whereby you can apply for us to visit your home and make sure it meets the requirement for it to be certified as a quarantine site. So let me provide you with our national website. It's www.covid19.gov.kn, covid19.gov.kn. And then on the home page, you will see a link, pre-approved quarantine site. And so you can just apply, put in all your demographic data, your address, and then your home will be visited. And once it meets the requirements, it can be certified. However, it comes with a security facility. Now, the Commissioner of Police will then have to approve security for that property. Now, we hear you that the present cost for the security facility is steep, and we have gone back to the drawing board to see what can be done in this regard. So that speaks to the returning resident, the returning national. So you can stay at a government designated facility. You can have your home or villa approved as a quarantine site with appropriate security. One of the questions, I am a tourist traveling from the US and have a villa booked in Nevis next month. My family and I will be there for a week. Do we have to cancel our villa and stay in an approved property in Nevis? Can you provide the name of the approved places in Nevis? And so no, you do not have to cancel your villa. What you need to do is to go onto the website, covid19.gov.kn, and apply for us to visit the villa, ensure it meets the criteria, and more than likely the villa can be approved as a site where you can stay. The other option in Nevis includes the Oahu Beach Hotel, Potworks, and of course the Four Seasons. The other question speaks to, okay, I would like to know, as a Canadian coming to St. Kitts for a month to visit fiance who lives here in St. Kitts. And so if you're an incoming traveler from Canada visiting your fiance, you can stay at any of the sites I just mentioned. You can, there's OTI, there's Royal St. Kitts Hotel, and there are the franchise hotels where you can stay for the first 14 days. And then once your PCR test is negative on day 14, you are free to integrate with your fiance.
Thank you. Okay, thank you, Dr. Laws. A couple of other questions came in. They are business related. One question is, as a business, how do we get to the next step of getting approved to be travel approved? As a business, how do we get to the next step of getting approved to be travel approved? And then there's another question, Dr. Laws and PM, how does your quarantine plan help businesses to pick up during this trying time in our island, such as overnight visitors, etc.? Dr. Laws and the PM, how does your quarantine plan help businesses to pick up during this trying time in our island, such as overnight visitors, etc.?
Very quickly, some of the questions that came before, the one on the price for nationals, we certainly will take that advice on board, and hopefully by next week we can announce, after some discussion by the Cabinet on Monday, a new costing structure to deal with the reality which the caller raised. So I've asked Dr. Laws to put an asterisk on her notepad so that the task force can look at that. The matter of the gentleman who called regarding a loan at Development Bank, I want to say that we will make effort to see the gentleman, but as a general rule, the bank follows banking procedures in determining applications, and there is no political suasion being exercised in the determination of loans. What the government has done is to provide certain support to have implemented certain policy initiatives. So we make a determination, for example, that we want to help government employees. And in that regard, we had introduced a $30 million mortgage financing program being executed through the Development Bank. I think it was at a 5% interest. So that is a government designed program. The Development Bank becomes the agency to which that matter is being dealt with. But in terms of determining who succeeds, the bank, of course, goes through a critical criteria. And one element of the criteria, or one of the criterion, would be that the person must be able to pay. Any lender has a duty and obligation to ensure that those who come before it to have access to other persons' money, whether it's in the bank, it is the depositor's money that banks lend, and hope that they will get back more through the interest. That is why persons complain that the interest and so on, that you end up paying 2, 3, 4 times sometimes what you would have borrowed. So that is the first obligation, because if you are not getting back, then ultimately the institution will close down. We are not going to be asking the bank to depart from banking rules, and that is why when the government wants certain constructive engagement, the government find a way of financing it within certain elements. I would want to make the further point that although the Development Bank is an entity owned by the government, controlled by the government through board's appointment, this government has allowed a transparent system of determinations of loans, and we would want that process to continue. Indeed, we are contemplating going to Parliament to make a change to one aspect of the law, which now provides that if the loan is above a certain magnitude, I think it's about $500,000, a line of evaluation, and make recommendations regarding that. We would want to keep those matters strictly within the confines of the bank, and I am proposing. That having been said, we will make efforts to reach to the gentleman. I'll give 2 numbers through which he can attempt to have the appointment made. 762-1558, repeat 762-1558, 1558 and the other number 661-1136. 661-1136, I think, would be the number. The other caller raised the issue and sought enlightenment regarding sustainable airlines for Caribbean travel. That has always been a challenge, and LIAT is not yet fully up and ready to operate. We will see what happens later. We should also bear in mind that LIAT is owned by its shareholders and perhaps its lenders to some degree, and therefore LIAT has been the key and the largest mover of traffic, people or passengers between Caribbean islands, and so that is now an important constraint. There are charter services and there are other airlines which make trips in between the member states. We will have to look to see what develops now that we are at a more critical stage with more islands opening up. Regarding how do you get an appointment, you can call my office at 467-1043, 467-1043. You can go to government headquarters and directly seek to make that booking. You can also call 661-1136 for an appointment, or 762-1558. Either of those numbers, the persons answering will attempt to assist in that regard. And I would want to venture how does the quarantine helps the business. Dr. Laws will give further information. In the COVID-19 environment, we have to ensure that persons are able to operate in a safe way. If we allow persons who come particularly from hotspots to integrate fully in the country, we are going to end up with trouble on our hands. Put it simply, we will have too many cases of COVID-19. Our health sector can become overwhelmed. Persons can die, and they will die if the numbers are unduly large. And that in itself will be bad for business, because the destination will now be reclassified at a high-risk one, and fewer persons would want to travel. Apart from our nationals, one of the reasons why tourists would want to come to St. Kitts and Nevis is that the government and people have done an excellent job in managing this country, and in that regard, the country is a lowest destination. Those who come to St. Kitts would want to ensure that having come in with their negative tests, having stayed for their estimated time or their planned time, they are able to return assured that they would not have contracted the virus in St. Kitts and Nevis. If persons are getting sick, your employees, you yourself, can get sick, and the business would have its challenges. Again, it is okay to make $1, but if recovering from sickness costs you $5, you see, in the end, the business would not be sustainable. So the very actions that we are taking to keep the country safe is to keep you safe to be able to operate your business. And you are looking, by and large, at more people coming in, which will bring increased demand. In order to sustain a high demand for tourist services in St. Kitts and Nevis, we have to keep COVID-19 in check, contain it, so that we maintain our lowest status. That is how the quarantine process helps. And also count the cost of people being sick and so on, both to their families, to themselves, and how that has a negative in terms of production and productivity at work. Dr. Laws, you may want to give your view on that, and how do we get to the next step to be travel approved? I'm not too sure.
Yeah, I could answer that.
But you can deal with that one.
Go ahead.
Yes, please.
Okay.
Thank you.
All right, so I just want to add to what the Honorable Prime Minister just mentioned. Are you aware most of the guests who comes to the islands, they usually stay for an average 5 to 7 days. And so how does your quarantine plan help businesses to pick up? Now, if you were to shorten the quarantine period, as PM says, you're going to end up in problems. There'll be an increased risk of reintroducing the virus into the population, and an increased risk of going into community transmission, and that's big problems. Now, how can the plan that we have proposed, how can this help? Basically, we are telling the tourists that you can come to this safe destination and vacation in place. For the average 5 to 7 days, they can go to the franchise hotel and enjoy a package of services for that period, and then they can leave. But guess what? If they need supermarket items, they can go online, and the local supermarkets can benefit. Those who have delivery services, because it can be left at the front desk in the lobby, and it can be, taken to the guest. You can go on to 869 to go, and whatever you order can be dropped off at the hotel. So other businesses, there are opportunities for other businesses, even with this plan that is proposed. There was another question. What's the next step of getting approved to be travel approved? Well, at present, the employees in these entities are being trained. Based on my information, the training is not complete. All right, this week we have 2 more sessions, at least 2 more sessions, and next week we have a number of sessions. So that's the first thing. The training sessions continue, and at present, the protocols are being finalized. We had a significant stakeholder meeting last Friday between the task force and the tourism authority, where we went through the proposed protocols with a fine-tooth comb, and they are being revised and finalized as we speak. All right, and so once the training is over and the protocol included in the travel bubble, read that in Jamaica there are at least 2 additional laboratories added to the panel of labs that you can reach in terms of getting a test. I actually spoke to the owner of Technological Solutions Limited in Jamaica, and you can get your test result in a day, or at least less than 2 days.
Good night. You're live on Leadership Matters.
Sorry to disturb you once again. This is Gene Howell. I've been hearing all evening and for the past weeks about the opening of the airports. What of the seaports to open to tourist arrivals by cruise ship and by private yachts? I'll listen again off here to get an answer.
We'll take a quick break, and then when we come back on the other... Oh, sure, sorry. Yes.
To make it clear that visitors can come for any length of time that they determine. The existence of a 14-day quarantine is an international best practice. This week, 14 students are going to Taiwan on scholarships, sponsored by the government as a result of the diplomatic relations that we have between St. Kitts and Nevis and Taiwan. When they get to Taiwan, they will be quarantined for 14 days. Taiwan, the Republic of China, is seen around the world as one of the best countries in terms of its management of COVID-19. It is just an eye shot, an arm's length, if you will, from mainland China. Just as we can stay from St. Kitts and look over at Nevis, you can stay from one of the islands or provinces of the Republic of China, Taiwan, and see the mainland next door. COVID-19 started on mainland China. Taiwan, its neighbor, has been able to keep the country relatively safe and is seen as having successfully managed it. It's having its quarantine of 14 days. If I were to leave St. Kitts to go to Canada, Canada hitherto had been seen as one of the countries in North America that was best at managing. In recent times, we have seen an upsurge in the Ontario area, province of Canada. But when you get back to Canada, you have to do the 14-day quarantine. Why? Because it is a best practice to keep people safe. We are saying that if you come for a shorter period than 14 days, it means, by and large, that you will have to be restricted in terms of your ability to integrate. You can't run from Bastille to St. Paul's to Old Road to Sandy Point, meeting Tom, Dick, and Harry, because that threatens the health and wellness of our citizens and residents here. Therefore, if you go to one of the franchise hotel or brand name hotel, like Park Hyatt, etc., which have already been pre-approved, has been able to deliver services and support to a guest, you can go there for the duration of your stay, and on the compound there already is a range of services that can be made available to you. So you're still welcome to come. If you are staying for a prolonged period of time, like the gentleman or the lady who called and said they were coming for a month, and we welcome those who are coming for long periods to come, just as we welcome those who are going to come for 2 days and 3 days. Then, of course, you have the 14-day requirement which would apply. In other words, if you're coming for 3 days, we can't say you have to be quarantined for 14 days. So it is whichever is shorter would be the period of quarantine. And if you are coming, though, from a country, one of the 8 we mentioned tonight, and I should say that it is possible that countries can get in and off the bubble, so we always have to have the latest information. If you're coming from a member state which is part of the CARICOM bubble, and you have your negative test, then you allow, as it were, national treatment, to use a construct from the common space, the single market and economy, which we have used. So you're given national treatment, and you are allowed to move around. So you can come, and Dr. Laws can correct. You have no signs, etc. You have your tests from a reputable lab. Then you can go to Tabernacle, and wherever else you may need to go, you can go to Black Rock, and then you are allowed to go back out. So we are attempting to minimize the risk for the same reasons that John Paul and Culture and others have been asking, are we ready for the opening? And the answer is yes, because we will live by the science. And the science assures us, as it has shown around the world, that if you were to take these particular tests or steps and comply with certain protocols, you can in fact work and live and move around as a tourist in a circumspect way that protects you and protects those who are resident on the island. So I just wanted not people to become confused with the gold standard being 14 days. And then persons say, well, my friend was only wanting to come for 3 days, for 5 days, for 7 days. It will be the shorter of the period. And it will depend on whether you're coming from a CARICOM bubble or you're coming from any other country, which in this regard we will classify as very risky. You're coming from the USA, it's a risky country. You're coming from the United Kingdom, it's a risky country. You're coming from Canada, it is a risky country. And our strategy, our plan, is to minimize the risk for you. Until there is a vaccine, when the vaccine will come, we have heard some optimistic news about its arrival. But until it comes and it is certified to be a safe vaccine and becomes readily available, we have to adhere by these particular protocols. And I want to make the point so far from the discussions which the experts have had with the persons in some of these branded hotels and in other hotels, they are satisfied that we are doing the right thing, and they are encouraged by the approach and the flexibility we have now brought into the conversation with them.
Thank you very much, Honorable Prime Minister. Indeed, the Honorable Prime Minister mentioned best practice, and we have been a best practice case, the Federation of St. and Nevis, on several fronts. Since January, the Prime Minister, the Honorable Prime Minister and his cabinet, as well as the Chief Medical Officer and health officials have been planning, and basically that's why we have come out ahead of this virus. We, in late January, implemented a robust immigration surveillance at our airport. And also, we've had some successes, many successes in our contact tracing. You've been hearing a lot about that. And so I'd like to, when we come back from the break, I'd like to ask the Chief Medical Officer to detail a little bit about contact tracing. Are there any plans to boost it or boost our capacity in that when the border reopens? So we'll take a quick break, and also too, the Chief Medical Officer will answer the question about the seaports. We'll take a quick break and we'll come back.
As we get ready to serve, it is important that we improve our vehicles to ensure the safety of our guests and ourselves. Outfit your vehicle with appropriate dividers to separate driver from passenger. Plexiglass or Velcro plastic divider may be used. Have a minimum of 2 hand sanitizers, one for you and one for your guests. Always carry extra mask and disinfectant in your vehicle, and post signs to remind passengers to use hand sanitizers and wear their mask and follow social distancing protocols.
When providing a service, it is important that the hands of the passengers are sanitized before entering the vehicle. Remember, a mask must always be worn by all occupants of the vehicle for the duration of the trip. At the end of the trip, remember to wish your passengers a good day. Ensure they have left no personal items behind, and sanitize their hands.
Once you have completed your trip, remember to sanitize your hands and your vehicle. Seats must be disinfected, and all high-touch areas, such as doors and seat handles, must be sanitized before your next trip. Let's do all we can to keep ourselves and our
Welcome back to Leadership Matters. I'll turn to our Chief Medical Officer, Dr. Hazel Laws, to address the questions.
Okay, the previous caller spoke about the opening of our seaports, in particular private yachts and regular cruise ships. Well, I'll begin by speaking to the private yachts. In the context of COVID-19, the preferred tourist is the longer-term tourist, meaning the tourists who will be coming for over 14 days, probably a month or even more. And so the private yacht owners is a target group that we would welcome because they would be coming for a longer period of time. And so the COVID-19 task force is presently considering a proposal. There's a proposal on the table involving private yachts. And so the protocols will be developed accordingly. Now, with respect to the regular cruise ships, the information we have received so far tells us that the regular cruise ship industry may not begin until about 2021. And so again, the situation is quite fluid, because I think I read last week that the head of the CDC in the US said that, you know, the startup of the cruise industry should be delayed until 2021, but then the leadership in the US says they need to consider a sooner startup date. So again, this is the situation is very fluid, but from where we sit, it's hard to predict what the cruise ship industry would look like when it restarts. And then until we have those details, we would have to delay our protocols until we are fully aware as to how that industry will operate in the context of COVID-19. Now, in terms of Valencia, you asked a very good question regarding contact tracing. Now, over the past 2 to 3 weeks, I want to assure the public that the Ministry of Health has engaged in robust training sessions for our cadre of contact tracers, and that is in St. Kitts and in Nevis. And so this training was in face-to-face by our district medical officers and our medical officers of health, and it was also online. The Pan American Health Organization has an online curriculum, and so our cadre of contact tracers, they were and have been exposed to this, and so they are better prepared as we are going into the opening of our borders.
I should congratulate you on the public education campaign. It's been a lot of months of repeated messages about good hand hygiene, also voiced by the Honorable Prime Minister in several of his speeches. Whenever he gets a chance to, he reiterates the wearing of masks, good hand hygiene, etc., social distancing, physical distancing. So thank you very much. I think there's a little bit of complacency and patting ourselves on the back. I see in the public that, and I hear on the radio waves, people saying, well, we don't have any cases of COVID-19 here. But I think it should be said that we ought to be very vigilant when the borders reopen. We've laid the Ministry of Health, Dr. Hazel Laws, the Honorable Prime Minister, have laid an excellent foundation with those repeated messages. And with the COVID-19 regulations, it's up to all of us now to work together and ensure that our border reopening is successful, not just on the business front, but on the health front. With that said, I'll turn to Dr. Laws to give her closing remarks, and then I'll turn to the Honorable Prime Minister for him to give his closing remarks.
Okay, so ladies and gentlemen, as we prepare to reopen our borders in about 3.5 weeks' time, I am asking you the public to prepare. All right? You and I need to protect ourselves from this virus. How can you and I do so? We can do so by wearing our face masks when in public spaces. All right? I think we slackened off over the last few months. We need to restart. So when we wake up tomorrow morning, we need to get serious about wearing our face mask. Once you're going out the house, make sure you have your mask and wear your mask in public spaces, because that's one very good intervention that will help to protect you from the virus when our borders open. Hand hygiene. We need to go back to having our hand sanitizers in our bags, in our cars. Again, we were a bit lax with this over the last couple of months. We need to get serious about that. Hand sanitize our hands, make sure our hands are clean, keep our hands out of our face, nose, and eyes. Physical distancing. Make sure when you're out, you maintain a safe distance of at least 1 meter, 3.3 feet from other persons at the supermarkets. You're going to wherever you are. Once you're in a public space, maintain your physical distance. You and I have a responsibility to avoid crowds, mass gatherings, or large groups of persons. And so when we hear there is a function, and why did you allow such a function? I think each of us have a responsibility not to go to the functions. Yes? We all have that responsibility. So wearing our face masks, hand hygiene, physical distancing, social distancing, and most importantly, we need to boost our own immune system. Once our borders open, there's a risk of the virus re-entering our federation, and it can spread. So if we are exposed to the virus, we need to boost our own immune system so that if we are, our bodies can fight it off, and then we may not even exhibit any symptoms, or if we do, it's only mild. So we need to make sure we rest, have adequate fluids, take our vitamins and supplements, eat healthily, plant-based foods, fruits and vegetables. We need to boost our own immune system as we prepare to open our borders in 3.5 weeks' time. Thank you.
Thank you very much, Dr. Hazel Laws, our Chief Medical Officer. Before I introduce the Honorable Prime Minister to make his closing remarks, I just wanted to muse out loud about, I don't think we realize how lucky we are. When people call me and they say, I'd like to meet with the Prime Minister, we do facilitate that. And I don't think there are too many countries in the world where that can happen very easily, but we facilitate that. With in this era of COVID-19, though, I guess we have to look at innovative ways, maybe phone calls. I'm not sure how we're going to do that, but maybe look at other ways, because 15 minutes talking in an enclosed space, there has to be social distancing, physical distancing, but we will try to our very best to accommodate you, because I know many of you very much would like to have an audience with the Honorable Prime Minister. So with that said, I'll turn to the Honorable Prime Minister so you can hear from him, hear his closing remarks.
Thank you very much, Valencia. I just want to again thank all those who called in this evening and who sent their own concerns via WhatsApp. I believe that this has been another very productive program, and I want to thank all the participants. Those who called from off island, your call was much appreciated, as was the calls from those who called within the Federation of St. Kitts and Nevis. We continue, and I in particular, continue to make myself available to assist with the educating, to assist with providing information, to assist with encouraging, directing and guiding our citizens and residents to make prudent choices. And this evening we discussed the matter of COVID-19, its implication on the opening up more fully of our borders on the 31st of October. I want to thank Dr. Laws, our Chief Medical Officer, for coming and providing as much information as we reasonably could have provided on an occasion like this one. The task force is available, and Dr. Laws did give their contact numbers. So if you have any queries, certainly please free to ask. We want you to be informed, and we stand ready, willing, and able to help you. There were some other issues that have come up, and we omitted the one in relation to the STEP program and what the transition will mean from the non-established, quote-unquote, no man's land in which the employees find themselves, as against the effort of the government to bring them more fully and more permanently as part of what is described as the GAE, Government Auxiliary Employees, with the associated benefits of insurance, of being able to get a job letter, etc., etc., etc. Those things are being worked on. We set up a committee headed by Mr. Levi Bratcher, the Accountant General, and comprising other civil servants to attempt to provide the necessary guidance for the most effective implementation of the policy mandate of the government. I intend that next week, Tuesday, or at the soonest available time, to have representatives of that committee to join me on leadership matters so that we could speak in a more detailed way about the significant plan of the government to regularize the status of some 4,000 persons, 3,000 plus on the STEP program and 1,000 plus as part of the now phrase non-established workers, that is workers at public works, water department, all over the service they are located, so we could have a fuller discussion with respect to that. There was the issue about the severance payment. I should say that that is a work in progress. This week I'm advised that 300 plus claims were processed, and those are going through the necessary procedures. Payments have already started, so if you have not yet received your part of a queue, we indicated last week that the government had put aside $11.1 million to make severance payment. So it will just be a matter of timing. I will ensure next week, Tuesday, we provide information about those companies, those employees to whom payments would have been made. That is the entity with which they work or from which they were severed, so that you can get an idea where you are in the queue. Hopefully by then much more of you would have already been satisfied. Last week when we spoke, $7.3 million worth of claim had already been processed, and this week a further number had advanced. So we will continue to work to make things right for the people of St. Kitts and Nevis, and we want to encourage you to be at your very best. The very best means to be sensitive about those less fortunate in our midst. Some persons have managed, for example, to be getting their stimulus and still to be on STEP or some other program. Right now, we are rationalizing the programs. One, to ensure that we are able to help each person genuinely in need for as long as COVID-19 is with us. And so we are going to be rationalizing the programs during the course of this month, ensuring that those who are getting twice and 3 times across different government support, that situation is unfair, and we will bring it to an end for the benefit of a larger proportion of persons being able to benefit. Thanks again for your support. Thanks for your prayers and well wishes. We shall continue to work hard to deliver on the commitment for the stronger and safer future. Thank you very much.
Thank you very much, Honorable Prime Minister, and thank you again, Chief Medical Officer Dr. Hazel Laws. And thanks to all of you for spending another Tuesday night with us. Good night.